Many oral complications can arise when patients are taking medications to treat systemic diseases. Systemic diseases are diseases that affect the entire body. Examples include diabetes, hypertension, epilepsy, and autoimmune diseases. Medications that treat these diseases negatively affect the oral cavity and cause complications such as oral hygiene habits, plaque biofilm composition and pH, sizes of gingival tissue, level of bone, and salivary flow. The image on this slide shows other types of systemic diseases that cause oral complications. An important role of hygienists is patient education. According to ProDent USA, patient education and communication allows you to facilitate meaningful change in your patients' lives. Patient education includes informing your patients about dental treatments, oral hygiene and prevention tips, and details about medications and their associated side effects. Patient education about medications and their associated side effects can reduce the medication related risks of periodontal disease. It makes patients more aware of these side effects if they occur so they won't be surprised or worried when they see them. Patients can also determine whether a medication is for them or not, and if it's not, a dental hygienist may need to intervene and help the patient change it. Medications that can alter plaque biofilm composition in harmful ways are medications that contain sugar. Examples are cough drops, cough syrups, chewable vitamins, and other over the counter medications. Sugar itself does not directly alter the biofilm composition. The bacteria takes the sugar that is in our medication and metabolizes it into acid. This acid then causes demineralization in the tooth enamel. The areas with rough demineralization has more bacteria and plaque biofilm built up against the tissues and causes inflammation. Periodontal diseases have a higher risk of occurrence because of this buildup. Some over-the-counter medications or OTCs contain both sugar and vitamin C. An example of this is Emergen-C. Sugar and vitamin C in some OTC medications create a lower pH in the mouth. With this, root caries is more likely to occur, and it also influences the metabolism of periodontal pathogens. Saliva is a component that is necessary for oral tissues. One of its roles is limiting the growth of pathogens in the oral cavity. The flow of saliva helps dislodge the microbes that are building up in the gingiva. Saliva causes aggregation of bacteria so they can be swallowed, and saliva is also rich in antimicrobial components that can kill or inhibit microbes. Xerostomia is a side effect in a condition where there is a reduced or absent flow of saliva in the mouth. More than 400 over the counter drugs have this side effect. Medications that cause xerostomia include cardiovascular medications, antidepressants, sedatives, and other medications. Patients with xerostomia can suffer with an increase of periodontal problems because they do not have the saliva to limit the growth of pathogens. Drug-induced gingival enlargement is a side effect that causes the overgrowth of gingiva due to medications. There are three categories of drugs that can cause this: anticonvulsants, immunosuppressants, and calcium channel blockers. These drugs influence gingival fibroblasts to excessively produce a collagen matrix when inflammation is present in the mouth. Clinical characteristics include painless enlargement of gingiva, as you can see in the picture shown in the next slide. It occurs in the anterior portions of the teeth, and there is also an increased risk of gingival bleeding. You will see this side effect occur within 3 months of your patient taking the medication. With enlargement, patient self care is more difficult. With the inflammation, your teeth are harder to brush and more bacteria can grow. It is important to reinforce and educate the patient on good oral hygiene. However, it is also important to know that good oral hygiene will not lessen the enlargement of the tissue since it is enlarged due to medications.
Anticonvulsants are drugs that can cause overgrowth of the gingiva as a side effect. One of the most commonly prescribed anticonvulsant medication is phenytoin, but it's also known as Dilantin, Cerebrex, and Phenatec. These drugs are used to treat epilepsy and control convulsions and seizures. Gingival hyperplasia caused by anticonvulsant drugs begins with the enlargement of the interdental papilla. These enlargements then form these triangular masses that protrude from the interdental papilla area. And as these masses grow larger and larger, they begin to unite with other interdental papilla masses that is adjacent to them. So then that brings you to the question, where is this gingival overgrowth usually seen more? Well, they're usually seen more on the maxillary and mandibular anterior teeth. But as you can see in this photo down here, it looks like it's in this person's whole mouth. It's very red, inflamed, it looks spongy, and there actually might be some gingival cerebral fluid somewhere in there. The clinical appearance of hyperplasia caused by anticonvulsant drugs, it would appear red with signs of edema. It would also be spongy. Opposed to a healthy appearance, it would be pink, firm, and rubbery. The side effects of gingival overgrowth occurs in about 40 to 50% of patients who take phenytoin, and it's actually most common to see in children and young adults. Phenytoin accounts for the highest prevalence of drugs associated with gingival enlargement. Immune suppressants are drugs that can cause gingival overgrowth. The most common drug is cyclosporin, but there's also Gengraf, Neural, and Sandimune. These drugs are commonly used for prevention of transplant rejection and management of several autoimmune disorders. Gingival hyperplasia caused by immunosuppressant drugs develop the same as anticonvulsant drugs. They begin with the enlargement of the interdental papilla, which then forms into these triangular masses that protrude, and as they grow, they unite. The clinical characteristics of hyperplasia caused by immunosuppressant drugs is that it can appear red, there's signs of edema, and it's spongy. Overall, it's just very similar to anticonvulsant drugs. Gingival overgrowth with immunosuppressant drugs can affect about 25 to 30% of adults taking this drug, and gingival overgrowth with immunosuppressant drugs can be as much as 70%. Meaning, if you're an adult taking cyclosporin, you're 70% more likely to develop gingival overgrowth. Calcium channel blockers are drugs that can cause gingival hyperplasia as a side effect. Some common drugs are nifedipine, ditanazine, funlodipine, nitrodipine, and verapamil. These drugs are commonly used in elderly patients who have angina or peripheral vascular disease. The development of hyperplasia with calcium channel blockers are similar to anticonvulsant and immunosuppressant drugs. They begin with the enlargement of the interdental papilla, which then forms into these triangular masses that protrude, and as they grow, they unite. Some characteristics is that they're red, there's signs of edema, and they're spongy. And calcium channel blockers accounts for 6 to 15% of drug-associated gingival enlargement. The role of a dental hygienist is to firstly educate their patient. They should be able to explain how oral complications could arise depending on their patient's medication. They should also help set up a treatment plan for their patient and help their patient understand how to perform good oral hygiene at home. Treatment of gingival enlargement includes consultation with the physician, substitution of the current medication, non-surgical periodontal therapy, frequent periodontal maintenance, and surgical therapy. Surgical therapy, though, is the most common way to get rid of gingival overgrowth. And it should also be noted if plaque cannot be controlled, overgrowth of this gingival enlargement can occur at a more rapid rate.